This 13 Friends for Life segment is sponsored by the Comprehensive Breast Centers at Mercy Health. Perhaps you've heard about the potential role of the ketogenic diet in cancer care. The diet has been all the rage in the media lately as a potential weight loss diet or as a strategy to reduce cancer cell growth. But is it really safe or evidence-based? Liz Weber is an oncology dietitian at Mercy Health Lax Cancer Center, here with some answers. And you too have been getting questions about this. What is this ketogenic diet?
So the ketogenic diet is basically a high-fat, low-carbohydrate diet. So it shifts the ratio of what we commonly think as carbohydrates to fat. So basically we shift the metabolism in the brain. So the brain prefers using glucose for energy. So in this diet, it actually shifts it to breaking down fat, or what we call ketones. When that happens, it causes ketosis. So basically the brain is using different types of energy. And the idea behind that is that especially brain tumors, so things like glioblastoma, the thought process or the theory is that with that shift of metabolism, the brain tumor may not grow as quickly.
This has also been used in epilepsy treatment, I understand.
It has. So the diet has actually been around for a long time, classically used in treating seizures and epilepsy in children and most recently in adults.
Okay, so I want to plow through what we currently know about this diet. You say, is it safe?
It is safe from the current studies we have right now. We know it's safe and feasible. We know that it should be done for at least 3 to 4 weeks for effectiveness. And we know that again, it can be done. It's just a matter of we have to consider also quality of life. So how is someone how is someone tolerating their current treatment, whether it's chemo or radiation? Is that really feasible to add this onto it as well?
There are a lot of questions that still need to be answered. I asked you during the break, what about how do you lose weight on a high-fat diet? That has to be yet answered. But also, does every type of cancer respond in the same way to this?
That's the key. So we have a lot of questions about it right now, and we need to know how will it fit, number one, in, if it is safe and we can use it and it's effective, how is this going to fit into different treatments? So is it going to come first before radiation or chemo, or in the middle, or what's that going to look like? And also, is every subtype of cancer going to respond the same? The brain is in mental health is a certain thing. We know that the brain reacts a certain way, but are other cancers in the body going to use those ketones similarly? And
how do you know that it's working, right? Is it a shrinkage of a tumor or is it just less symptom? What would it be?
Right, and that's where finding, especially in treatment, and how are we going to know, is it the ketogenic diet that's reducing that tumor? And in epilepsy, we know because they're not having seizures. In this, we don't know as well unless we're doing re-imaging, re-scanning to check that tumor size.
There are some side effects, right?
Yes, constipation, fogginess, lightheadedness, fatigue, those are some of the things. As far as constipation, that can be pretty easily managed. So some of these, again, depending on how that person or that patient is doing at that time, those may be things to consider.
Better research needed. You have obviously made that clear, but the good news is that there are some clinical trials utilizing this diet.
Yes, there's a lot of trials going on right now. So I think over the next 5 to 10 years, we'll see some interesting stuff come out, especially relating to humans. There's a lot of animal studies out there that are showing its potential. We're seeing some positive things, but we need more at this time.
Well, it's showing exciting promise, that's for sure.
Absolutely.
And something to keep asking about. Well, you can learn more about the Comprehensive Breast Centers at Mercy Health on their website. We've put all their contact information on our site at WZZM13.com under Friends for Life.